Hi everyone, welcome to this channel. I'm Zahra. I've been working in the field of midwifery education for 8 years. Whether you're starting out as a midwifery student or you're getting prepared for your future clinical practice, this video is for you. It's absolutely for you. We're going to cover the 10 top essential skills every future midwife should be informed about it and should master these skills. The skills that may go way beyond the textbooks or even lectures. So grab your notebooks or just listen in and let's dive right in. Let's start with something you use every single day. I'm not just talking about giving instructions and presenting solutions. I'm speaking about active listening, using reassuring language, and also being culturally sensitive about your clients. As you know, you need to connect with families and women from different backgrounds from all around the world and sometimes in very vulnerable situations. A midwife with a strong communication skills can build better clinical decisions and builds trust and also reduces fear, anxiety, and stress of women in very sensitive periods of their lives. The next skill is clinical assessment. You need to know how to assess something very important like fetal heart rate, vital signs, uterine contractions, and also the signs of labor progression. These aren't just routine checks, they guide your important clinical decision making. A small detail like a change in fetal heart rate can be a sign of something serious and may need to emergent action. So, the sharper your assessment skills, the safer your care. Can you guess what's the next skill? You're completely right. Emergency management. As a midwife, you need to know how to respond quickly to things like postpartum hemorrhage, neonatal resuscitation, or preeclampsia. Emergencies don't give you time to think, so you have to act fast and correctly. But the question is here, how can I get ready for these important situations? You can practice in simulation labs, visualize the steps, and stay calm under pressure. And all of these require practice. Good old hands-on techniques during labor and birth are really important. The things like using supportive positions to help labor progress, giving gentle perineal support, or handling situations like shoulder dystocia. But here's the thing, you don't really learn these from books. Therefore, you've got to watch, practice, reflect, and just keep getting better with every birth you attend. So don't be afraid to get involved. Ask your questions and really pay attention to what happens every day and in every situation. This is how you build confidence and also skills. Breastfeeding support is another must-have. A lot of new mothers struggle in those first few days after birth. You should be able to teach latching techniques, identify common problems, and most importantly, encourage them. A kind word and some guidance can make a world of difference. Documentation and record keeping is another skill you should be able to do. Now, this one may not sound exciting, but it's crucial. Your charts and records need to be accurate, clear, and timely. They are part of legal protection for both you and the client. Always document what you observe, what you do, and how the client responds. One of the most important principles that every midwife should be committed to, and something I personally try to prioritize, is ethical decision making. As a midwife, you'll face tough ethical decisions. When does patient autonomy outweigh medical advice? How do you approach care that really conflicts with your personal beliefs? Respect, empathy, and ethical reflection are part of a professional practice. The skill number 8 is teamwork and collaboration. Midwifery is never a solo job. You will work with gynecologists, pediatricians, anesthetists, and also nurses. You need to know when to escalate, when to refer, and how to communicate clearly under pressure. A midwife who works well in a team will definitely protect many lives. We are almost at the end of our list, but this one is just as important: emotional support and counseling. Childbirth can bring joy, but also trauma and grief. You need to be ready to support women emotionally after traumatic birth, loss, or postpartum depression. Sometimes just being present and listening makes all the difference. And finally, never stop learning. Midwifery is constantly evolving. Attend workshops, read the latest guidelines, and reflect on your practice. The best midwives are always learning, always growing. So, there you have it: 10 skills every midwifery student needs to master. Which one are you working on right now? Let me know in the comments. I would love to hear from you. And if you found this video helpful, give it a thumbs up, subscribe, and share it with your classmates. Thanks for watching, and I'll see you in the next one.